Welcome back to My View. The MAHA movement has made great strides in raising awareness about the quality of our food systems and the rise of chronic disease, uniting parents from across the political aisle. But arguably, none of this would be possible without MAHA moms. They're a devoted group of mothers who are increasingly concerned about the health and well-being of their families. And they've shown they're not afraid to speak up.
The Make America Healthy Again movement is an answer to my prayers. I have 4 children. I'm concerned for their health and their children's health.
My children were sick, all 3 of them. I was told they're just going to need to be on chronic medications forever, and that's going to keep their diseases at bay. And I just refused to take that answer for one more day. So I started changing our diet. I changed our lifestyles. All our kids came off medications. And because my children's lives change, my health changed.
Unbelievable, but the Democrats and liberal media have tried to smear them as conspiracy theorists. But today, we're going to get the facts. Self-proclaimed MAHA mom, former Sports Illustrated model, and founder of Super True, Kristen Louelle Gaffney is here, along with internist, addiction medicine specialist, and chief patient officer for the wellness company, one of America's doctors, Dr. Drew Pinsky. Welcome to both of you.
Congratulations. It's such
Thank
a
you
privilege
very
to
much.
be here.
So
Yeah,
cool.
this is
Oh
exciting.
my gosh. Well, this is such an important topic and something people, Kristen, are so interested in, and with good reason. I think all of us wonder, is what we're giving our kids making them healthier or making them sicker? Do you feel like, as a MAHA mom yourself, that the reason people continue to kind of go down the wrong path with health and nutrition for their kids is just because we've been given bad information or maybe the wrong information?
I absolutely say that it is a lack of information and education, really. I mean, we're learning about crazy things in school when we should be learning about how to do your taxes, how to take care of your body and your family. And like RFK has said, obviously I stand behind him, is it's pissed off moms that honestly are going to make this change.
Yeah.
And it does come to lack of education. I think most parents do have good intentions, but it does come to lack of education. So we just need to work on educating ourselves. And social media, you love it, you hate it, but we're finding out so much because of this movement.
It's true. And Dr. Drew, you say the food industry is a business not of nutrition, but of addiction. Tell me about that.
They've created the people that brought us tobacco and the strategies used and the lobbyists used and the marketing strategies used all moved on over to food. Food companies bought the tobacco companies, moved those people over, and now they created addictive foods. But when it comes to MAHA, I just want you to know there's going to be layers and layers and layers to this.
Right.
The first layer is we've got to ask questions. It's clear we're not healthy. Why? What are the answers to that? And I think you put some data up about our age of death is dropping.
Yes.
We're doing much more poorly than other countries. Lots of theories as to why. I'm going to tell you that addiction and psychiatric problems, we haven't even gotten to that yet. And that is going to be a major contributor as well.
Yeah, I mean, you look at the food supply alone, you could spend how long on that, but you're right, there are all these different layers to it.
Just look at the food pyramid. It's been wrong for 50 years.
Why is that?
Why did you do that, government? Why does the government screw everything up?
It's because if we're fat, sick, poor, infertile, and blatantly stupid, there's a business. It's a $1 trillion industry.
It's
a lot of money
follow
to
the
be
money. I'm so optimistic about this country and people. I can't quite do that, but you're probably right. It's follow the money. Let's undo that.
Hey, the only difference between a conspiracy theorist and the truth is 6 months.
That's what they say, or even 6 weeks these days, Kristen. Kristen, what are some tips that you would give to parents out there who say, look, I don't even know where to start, but I know that I want to start doing better for my kids?
Yeah, I think it starts at home, and I think that we forget that we have so much powers within our households. It can be as small as you're the snack mom at soccer this week. Lead by example. Our kids are watching us. My child is here right now in studio because I want to show him what I'm doing, and we have a voice clearly. The moms got behind this movement. Look what we've done so far, and I cannot wait to see what we do.
Dr. Drew, there's an overwhelming number of medical schools who actually don't do any sort of nutrition whenever you're teaching our future doctors. What is that?
Well, what that is, and I've defended that over the years, is that we're so busy taking care of disease and trying to deal with the things that shorten life, we cannot get involved with the phenomenon, the foods, the nutrition that lengthen life. And we are at a crossroads now when we can actually do things to lengthen life. I can tell that you, and I think the 3 of us, working out, exercise, resistance training. That is number one. We should all be doing that. Number two, as you mentioned, the hard work of proper choices. It's not easy. The addictive, yummy stuff, much easier. We're busy. Kids sort of blow through us with their demands. No, we got to do the hard work of standing firm and making good choices. And if they've gotten off track, remember, change is hard, and do that work to make sure they're able to make proper nutritional choices and get them on sports and working out early.
Yes.
Make it a part
and
of
like
life.
you said, we have an industry that is reactive. As moms, like going back to your question, we need to start being proactive. What can we do now to avoid the issues in the future?
And it's hard. Look, I know.
It's hard. That's the bottom line. Acknowledge that it's hard.
It's hard too. My kids are 5 and 7. How old do you have?
8, 7, and 2.
Okay, so my kids come home from school, and I do my best to pack them these healthy lunches.
Yeah.
And they say, so-and-so's got this fruit roll-up thing. Can I get that next week? And I'm like, oh, what do you tell your kid? You took matters, though, Kristen, into your own hand and started your own food company.
Yeah, and my story really was my kids were doing sports, and they were left with that token cutie orange. And I felt like this mom, like, oh, well, all the other kids are getting this. So I said, screw it, I'll make my own. But like I said, I want to lead by example. And I think what's important for me and what I try to tell my kids and other parents is I educate them as to the why. You want them to have a healthy relationship with food and activity. So why can't you have that? Or why are we having this or doing this and having this activity instead, so that they're learning and having a healthy relationship?
And to be fair, we sort of breathe rarefied air. You and I certainly do in terms of understanding the why. A lot of people don't know, and we need to do a better job of getting people up to speed.
Yeah, well, part of it is educating people, and part of it, Dr. Drew, is just calling out the problem. And I think that's why RFK Jr. is such a big deal as our HHS
There are
secretary.
so many, I have such high hopes for him. When it comes to medical literature, medical publication, the cozy relationship with the FDA and pharmaceutical company, the food industry. The one thing I just want questions asked, and I want real answers. That's really what I'm looking for. I don't want us to throw the baby out with the bathwater. We do lots of good things too, but we must have answers to some questions that are really adversely impacting our health. You would never create a healthcare system like this de novo. The healthcare system we have in this country is insane. We would never create it like this. It's time to re-empower the patients, re-empower the individuals, re-empower the doctor-patient relationship, let people make their own choices, get the government out of it. Guess what? Things work better then.
Yeah. Kristen, what would your hope be 4 years from now as Donald Trump is ending his second term in office? We've had, RFK Jr. in as our HHS secretary for 4 years. What would be your big hope for the future of this country?
You know what's so funny is before the president was elected, my hope was just to have awareness. But what we've seen just in a month he's been in office.
Amazing.
Action. It is all about action. So I am so excited to actually see bills go across the table, get signed. Like he was saying, I just want to have a healthy relationship with the government, with our doctors. Provide education in schools would be my number one. As a parent, that's my number one wish, is to have some real education, not just a class in education around health.
And, RFK's history has been about dismantling complex systems, looking at the adulterating influences. That's first order business here. What's gone wrong?
Right.
What do we need to do to correct it? So patients and doctors and families are able to do what they need to do on their own. We don't have to be up there, in their lives all the time. We don't make things better. We have made things worse. Is there not evidence of that?
Unfortunately, that's the truth. What is the number one thing you get asked? I mean, you're Dr. Drew. People must come to you all the time and say, tell me something I need to know about what's going on. There's so much information. What do you get asked all the time?
I get asked everything, to be fair. I guess, I get asked about GLP-1s all the time, and I'm gravely concerned. I'm gravely concerned about overprescribing generally.
Yeah.
That we as physicians have a tendency to open our prescription pad up and just, here, take a medication, and we don't have time to do anything else. When the reality is the time spent with patient, the time helping them change, the hard work of the interpersonal, the patient-doctor relationship, we've left that out completely.
Yeah.
And restoring that would really help us make people healthy.
Do you ever see a day where we have insurance companies paying for people to stay healthier instead of paying for them after they're sick?
I don't know. I don't know the answer to that. I wish the insurance companies would just get out of the doctor-patient relationship. And if there's nothing we can do as physicians that the insurance company isn't judging, second-guessing, telling us what we can and can't do. It should be the physician judgment is the reason the patient gets the care, and that's it. And we just go from there.
there's no money in us being healthy, but how nice would it be if you had
you're so conspiratorial.
I know, right? Hey,
but
check
you may
the
be
numbers.
right. You could
check
be
the
right.
numbers, all right, guys. But if there was a prescription to a gym membership or a treadmill or a meal
There's some
service,
companies that do that,
yes,
right?
which is
and
amazing.
It's great.
That's amazing.
But we've got to get people to do it. This is the hard part.
Well, we're hopeful.
Behavior change is hard, and we
we're
must
hopeful.
do it.
Well, it starts here today. Dr. Drew, Kristen, thank you both so much.